justice. So today we're going to go over some lung and large intestine acupressure points. And I did a video earlier on other lung and large intestine points, particularly for supporting the immune system and respiratory system, which, if you're interested in that, you can find in on YouTube or in Healing Group on Facebook. And so today, the lung and large intestine points we're going to talk about are particularly good for clearing heat. And so heat in Chinese medicine translates to inflammation, infection. Redness is usually indicative of heat, so a red tongue for sure. And for more about tongue diagnosis, you can look at my videos on tongue diagnosis. And also on the skin, redness of the skin or eyes is all indicative of heat, all in this kind of big category together. And so when it comes to the lung, it may be like a respiratory infection, and producing phlegm that is like yellowish or greenish even in color, indicative of infection, whereas white or clear phlegm may be, due to like allergies, and so not an infection, or which is seen as a source of heat in Chinese medicine. And some of these points are good as well for just systemic heat in the body, so not necessarily just in the respiratory system. And in general, as you may know from previous videos or knowing about Chinese medicine, the organs are not only associated with the actual like physical organs. Of course, they're associated with the meridians themselves, and they play different roles than their Western organ functions. So, but that being said, a lot of these points do relate to the respiratory system that we would expect when we think of lungs. And a little bit about the large intestine as well, but more so focused on the lung today. So the first point we're going to talk about is the first point on the lung channel. So it's right here on the very edge of the chest, kind of to the inside of this, the deltoid, the muscle kind of capping the shoulder. So a couple ways to find this is you can feel for your clavicle. So that bone that comes across, straight across, and feel for the space under there. And then you're going to come into the first rib space. And so on the very edge of the chest, like I said, kind of right inside this line of the deltoid. And that is lung 1. And so with acupressure, there are different ways that you can apply self-acupressure. You can simply press in on the point, press and hold with the pad of your thumb, or you can use your this knuckle of your finger. You can also pulse it, or you can make a circle one way or the other way. So typically circling clockwise, so like if your body is the clock, circling clockwise draws energy to the point, or chi to the point, and circling counterclockwise disperses chi or energy from the point. So you can use any of those methods, as well as a few different methods that I will talk about for some of these points that might make it easier with points that are more difficult to reach. So this being one of them that might be a little hard to press on yourself. And all these points we're going to talk about are bilateral, so on both sides. So another way to stimulate this point is to make a kind of beak with your hand and peck right on the that inside of the deltoid muscle, the shoulder, where the chest meets, or where the edge of the chest is. And so you don't have to get as specific. Another good key thing to remember is that acupressure points will be tender, so maybe varying degrees of tenderness, but typically if you feel tenderness, that's the point. Like that's where you want to stimulate, even if it may not be precisely where you thought it was described. So a pecking motion is a good way to stimulate this point, as well as the second point on the lung channel, which is actually right under the clavicle. So you can kind of find that lung 2 first, and then come down one over one rib into the second, or to lung 1. So you can do this for a minute or however long you have. And this is a good point for, as I said, clearing heat. So this could be good for if you have some kind of respiratory issue, also for not only infection, but if you have shortness of breath, difficulty breathing, asthma, and this can also help to clear mucus from the nose. So the lung in Chinese medicine opens into the nose. All of the yin organs are associated with a sensory orifice. So for the lungs, it's the nose. So this point can help to clear mucus out of the body from the lungs, the nose. So if you start coughing and producing mucus, the point is working. So that, and it can also help to, so it may stimulate some of that, but ultimately help the lung in its function of descending qi and disseminating the qi from the air. So ultimately we want our lungs to move qi downward rather than up, so which we talked about in the class on the functions of the lung. So and then another thing that this point can be good for is for shoulder pain. So even if it's on the posterior or the back of the shoulder, this can be a point to provide relief when you can't access on yourself the back of your shoulder. So from the front of the body, you can apply pressure to that point for shoulder pain. And moving down the lung channel, so it comes up around and then down on the outer side of the biceps, or on the thumb side where the lung channel ends. And we'll get to that point eventually. But for now, we're going to go to lung 5. So this point is located on the elbow crease, so that's pretty clear, pretty easy to find. So you can even bend your elbow a little bit just to make it more distinct. And that will help you also to feel the bicep tendon that comes to and attaches in the middle of the elbow crease. And so you feel for that, you know, that it's like this taut kind of feeling right under the skin. And if you come to the thumb side or the outer side, lateral side, many different ways to say it, you fall right into a hollow there, and that is lung 5. And another tip with finding acupressure or acupuncture points is like a point where you feel kind of drawn in, and it may be, you know, maybe sometimes the point is not big enough to accommodate your finger, you know, hence needles and acupuncture, but you can still feel this little pocket that anatomically and perhaps energetically, and so sometimes maybe just your nail you can use. For this point, I think you can just use the pad of your thumb easily, and feel for that tender spot. So you may need to press down a little more deeply, but you never want to like just jab it, force it in, kind of sink in consciously, intentionally, so you feel that tenderness, like that good ache. And so for lung 5, this point again can support in clearing heat from the lungs if you've got an infection like bronchitis, and can also help to descend the lung qi to stop coughing. So it can be helpful for cough, wheezing, asthma. This is also the water point on the lung channel. So think about the kind of cooling, calming effect of water and heat clearing with the water element. And this point also is can be supportive if you have facial edema, so helping to regulate fluid circulation and elimination in the body. So typically if it's an upper body edema, that is associated with the lung, whereas lower body edema would be associated with like the spleen, the kidneys. And it can also help with certain cases of frequent urination. So it has this role in regulating fluids, and which we touched on in that class on functions of the lung. Also can be used locally for pain or tension in the elbow or the arm, kind of opening up that lung channel. And so next we'll go to the end of the lung channel. So it's what's sometimes referred to as the nail point. So all the upper body meridians begin or end at nail points. So you find those by, you can draw an imaginary line from the bottom of the nail and whichever side of the nail the point is on, and then where those two lines would intersect, you find the point. So yeah, and this point might be easiest to stimulate with your nail, because it's just a tighter area. And so this point is a good one, especially for the throat, So the lung connects to the throat, and so this is a good distal point for painful sore throat, strep throat, even tonsillitis. And especially good to seek professional care for this, because you can just prick the point to bleed it a little bit, and that's the best way to treat that case of strep throat, or the really like painful sore throat, is to just prick it, and with like a mini, like a lancet, and relieve. That's a way of kind of releasing heat from the channel, and from distally from the throat. So that's kind of the big use of lung 11, the primary use. And in general, nail points tend to be indicated for reviving consciousness. So this is one of those points that is said to be able to revive someone who has passed out. Yeah, something to keep in your back pocket. And lastly, we'll talk about large intestine 11. So large intestine 11, going back to the elbow, is located, again, it's right on the edge of the elbow crease. So maybe easiest to find this point by laying your forearm across your body, or just kind of bending your arm at least. And you can, to get more specific, you can find it by coming midway between that bicep tendon we talked about earlier that attaches in the middle of the elbow crease, and the lateral epicondyle is what this little bony, not this big, not your elbow bone, but this one right here. So coming from those 2 points, those 2 anatomical markers midway between, but I think it's just easiest to just think the edge of the elbow crease. And again, looking for that little like dip that you can sink your thumb into. And this is the principal point in the body for clearing heat. So it doesn't matter where. I remember a teacher describing it as like a fire truck, where you use other points to direct it where it's going to go, but this is going to be the point to clear heat. And so I will use this point for a lot of different things. It's also indicated for, especially for skin disorders like dry, itchy, red, rash type skin conditions. So eczema, psoriasis, just any rash really, or itchiness without a rash. Someone just has this inexplicable itchiness. That's a point that I would use for constipation with signs of heat. So easy way to tell is by, once you get comfortable looking at tongues and telling the difference in color from a pale to a red, etc. But it's pretty easy to tell a red tongue once you've seen just a few, to know that person has kind of more of a hot constitution. So in that case, large intestine 11 would be good. And more modern use of it is for high blood pressure. So high blood pressure, skin issues, constipation with heat, and itchiness, oh, hot flashes. So that's in the case of hot flashes. I would also use yin nourishing points, so that'd be a different class, but that's one point to at least help with clearing the heat. So, and then lastly, it is also a major point for just any kind of issues with the arm, whether it's pain, weakness, paralysis, numbness, or tension, just any kind of issues with the arm itself. It's a great point to kind of open up the channels and to get the qi flowing. So those are the acupressure points for today.